My name is Hannah Dar, and I will be covering the hepatitis A virus. Hepatitis A virus is a member of the Coronaviridae family and classified under genus Hepatovirus. It is a non-enveloped isometric capsid that is small and circular. Its genome is a positive-sense single-stranded RNA. What does hepatitis A virus cause? It causes an acute infectious disease known as hepatitis A, which was once known as infectious hepatitis or the epidemic jaundice. Infection of hepatitis A is rarely fatal but can cause serious liver disease or liver failure and mild to severe illness within the individual. There is an estimated 1.5 million cases of hepatitis A reported annually worldwide. Human beings are the natural host for infection. However, the virus can survive outside of the body for months. More than 80% of hepatitis A cases acquired during childhood will be asymptomatic, whereas the adult infection is much more likely to produce the clinical symptoms. Locations at risk for hepatitis A are less economically developed or have poor contaminated water supply. Poor sanitation and overcrowding also favor the spread of infection. So how does hepatitis A become a disease? The hepatitis A virus becomes pathogenic in individuals through fecal-oral transmission and occurs especially among close contacts with infected persons. Once ingested, the virus multiplies in their intestine and invades the blood, stool, and saliva even before an individual's symptoms will arise. HAV then attaches to the liver cell to replicate and begins its damage. The incubation period of hepatitis A is approximately 15 to 50 days. The hepatitis A virus is also very contagious. As said earlier, the major route of transmission was the fecal-oral route. Examples of this can consist of certain types of sexual contact, close contact with someone who is ill, or ingestion of contaminated food and drinks. Symptoms include chills, dark urine, nausea, fatigue, loss of appetite, fever, headache, vomiting, and jaundice. And jaundice is the yellowing of skin and eyes. No specific treatment really exists for hepatitis A. Doctors will recommend rest, proper use of medication, proper nutrition, and proper hydration within the individual. However, individuals with severe symptoms will be hospitalized. Hepatitis A can be prevented through vaccination. The vaccination today is known as the Gamistan SD, and it is the only immune globulin product approved by the FDA for hepatitis A. Although an HAV vaccine has been developed, outbreaks of the virus and threatening infections are still observed worldwide. These are especially seen in man-to-man sexual contact, which we will cover later. In saying this, it's been questioned if the HAV vaccine should be developed or doses should be boosted. The current research on hepatitis A that I found was actually through the University of Zaragoza in Spain. They recently researched the increased outbreaks of hepatitis A, stating that it is a public health concern and it was a challenge to control. Their survey included 881 men who had same-gender sex and were associated with hepatitis A infection. Of all respondents in the survey, 83.4% engaged in anal sex and 71.3% in oral sex. Another study came from a European-wide hepatitis outbreak. This outbreak reported a total of 48 cases and 30 possible cases. Among these cases, 69 were male. That is more than 88%. The two epidemic waves were observed and found that they were through gay dating apps and one in a specific sauna that the individuals were going to. Both of these reports showed that many of the individuals involved even lacked common knowledge of the virus and the vaccination available. In response, they sent out 2 vaccination campaigns. The campaigns and community-based organizations were involved in sexual health promotion and remain proactive. The research shown also concluded that low-cost studies, implementing harm reduction strategies, and continuous social promotion through social media, male dating apps, gay venues, and more could all help aid the outbreaks.